Hello, everyone, and welcome to today's webinar. We are discussing Tarleton State University's new program in physician's assistant medicine. And so we are pleased to be joined by two representatives of the program. As they're going through their presentation, if you do have questions, we ask that you go ahead and submit them using either the chat box or the Q&A box, and we will handle those at the end. But for now, I will just turn things over to them.
Good afternoon. I am Dr. Brenda Diaz, and I am the founding program director of the Master of Medical Science in Physician Assistant Medicine at Tarleton State University. I have been a physician assistant for 37 years, and my area of expertise is family medicine, but in reality, it is pediatrics. I have about 15 years of experience in academia. We are very, very excited to be here. This program represents much of my career as a physician assistant delivering healthcare in deep, remote rural communities. So I'm delighted to be here with you. And with me is my esteemed colleague, Professor Heather Holbrook, and I'm going to let her introduce herself now.
Thank you, Dr. Diaz. So as Dr. Diaz said, my name is Heather Holbrook. I am a proud Tarleton grad, class of 18, so I am beyond overjoyed to be a part of this new program and to have the mentorship of Dr. Diaz. My clinical background as a PA has been in a variety of specialties. I can really say that I embody the lateral mobility of a PA. Been in emergency medicine, I've been in burns, primary care, and currently in orthopedics. I am new to academia and I'm very excited to be here. I'm currently serving as a clinical assistant professor for the program and chair of admissions.
So at the beginning of all our presentations, we like to start with a word of wisdom, a word of inspiration. And today, the word is vocation. Vocation is a word that has been lost in our vernacular. We don't use it that often, but for us as physician assistants, it's very meaningful. Frederick Buechner defined vocation as the place where your deep gladness and the world's deep hunger meet. And as physician assistants, our joy and our gladness is in serving our communities as healthcare providers. And we go to areas where the deepest needs are. It is extremely rewarding. I can speak to that as a veteran PA for 37 years. Even today, when I wake up in the morning, I am still filled with gratitude and with joy that I'm able to serve as a physician assistant and now as an educator.
All right, so what is a physician assistant? So many of you that are joining today probably have an idea of what a PA is, but for those who don't, we're going to go over that now. So a PA is a nationally board certified licensed medical provider. We diagnose illness, develop and manage treatment plans, prescribe medications, and often serve as the patient's principal healthcare provider. This is exceedingly relevant with the mission and vision of our program of working in rural medicine. So often in rural medicine, the PA may be acting as the sole healthcare provider in that general region. And as long as they can have access to their supervising physician, they're allowed to do that. So that is really where our mission is coming from, is to fill that gap of healthcare. A tagline that I often say when speaking about our program is, out of the 254 counties in Texas, over 200 of them are medically underserved. And that's what we're trying to do. We're trying to fill that gap. This slide really embodies all the different specialties that a PA can be a part of. So PAs can practice in any specialty. We see all age groups and we see all stages of lives. In this picture, you can see at the top, maybe we are in the trauma bay and accepting an ambulance as it's coming into the ER. We can practice in the clinic, outpatient or inpatient. Maybe we're first assisting the OR. So there's no specialty that's off limits for a PA. So what is the education level of a physician assistant? Currently, and as our program is at, we are a master's levels program. We do anticipate over the next 5 to 10 years that we will be elevated to a doctoral program, and those standards have already been released by ARC-PA, which is our accrediting body. When that change happens, our program is prepared to move to that doctoral level, but currently we are a master's level program. So, like most things in our world, medicine is constantly evolving, and PAs, we need to evolve with it. So in order to make sure that we are meeting the standards of care that we need to, PAs are required to maintain or complete 100 hours of continual medical education every 2 years and recertify every 10 years. And that is done by our board organization, which is the NCC-PA.
So we are required in any public arena to state that we are a program institution that is seeking accreditation provisional from the Accreditation Review Commission on Education for the Physician Assistant. We anticipate matriculating our first class in April of 2026, pending the achieving accreditation provisional status at the September 2025 meeting, which just occurred 10 days ago. So we are expecting a positive outcome. We are excited about once we receive the accreditation provisional status, we will be publishing it in CASPA and across all media outlets. Thank you. The mission of the Tarleton State University Master of Medical Science and Physician Assistant Medicine is what drives our program. And the words that I'd like to really focus on in our mission statement is that we educate servant leaders. Servant leadership is at the core of what we do. And we hope to instill that in our learners here at the PA program. We also want to provide exceptional healthcare in an interprofessional setting in rural, medically underserved populations through community involvement, public health policy, and advocacy. And you will see that those topics and those concepts interwoven throughout the curriculum. Our vision is to be recognized for our commitment to excellence in physician assistant education, scholarly activity, and servant leadership in the areas of health disparities and healthcare access. Our values are those of the Division of Health Sciences. We honor and abide by these values of being mindful, being excellent, being creative, being open, and being a role model. So our program is a 28-month continuous competency-based residential program. When we speak about competency-based medical education, we refer to those skills that are observable. So in our program, you will have hands-on activities from the very beginning, because we are observing that you are able to demonstrate the skills that we are teaching our learners. It is a residential program. It is in person. We do have a few courses that are offered hybrid, but the program is an in-person residential program. We have three major areas of the program: the didactic phase, the clinical phase, and the research, which is required for graduation. Our didactic phase is a 16-month didactic phase systems-based curriculum, and which includes instruction in foundational biomedical sciences, clinical medicine, public health, and psychology of medicine are the broader scope of our curriculum. Here we have the curriculum in a diagram. Our curriculum is based on the concept of skill acquisition, the theory of skill acquisition. So at the beginning, our first semester are our biomedical sciences, and we have our clinical anatomy and radiology course. We have a state-of-the-art anatomy lab that includes a multimodal approach where we have multiple modalities that we use to provide instruction in anatomy. Along with that is medical physiology and pharmacology, and epidemiology and biostatistics, medical interviewing and counseling, and the physician assistant delivering healthcare in rural America and beyond. And we also will be having our first interprofessional seminar. And during these seminars, we will be interacting with students and learners from the different disciplines within the Division of Healthcare of Health Sciences. So that will include physical therapy, occupational therapy, nutrition, nursing, and clinical social work. Once the students complete the first semester, then we move on to the second semester. Now we're starting to really pay attention to the students' ability to demonstrate the application of clinical concepts. So the first 5 courses that you see here, clinical medicine, the physiology of disease, pharmacology, to clinical laboratory and diagnostics, those courses are all taught co-relative and in tandem with each other. So that means that if we're in clinical medicine 1, we're covering dermatology, that means we're covering dermatology of the pathophysiology of the skin, the pharmacology of the skin as it relates to the skin, clinical laboratory and diagnostics as it relates to the skin, and we're teaching you how to examine the skin. So with this approach, all of the concepts are being integrated, and then at the end of the dermatology module, you will have an assessment which is known as a objective structured clinical examinations, in short, OSCEs. And that's where we will have an actor posing as a patient and in an exam room, and you walk in and they will have a dermatologic problem. And what we are observing is, are you able to take a medical history? Are you able to do the examination appropriately? Are you able to order appropriate labs? Are you able to come up with a diagnosis and treatment plan? And as you can see, that is what competency-based medical education is based on, our ability to observe your ability to demonstrate these skills. We also have our first course in our research series, Evidence-Based Medicine 1, Public Health Principles, Policies, and Rural Health Advocacy is the cornerstone and foundation of our program. During this course, you will learn principles of public health, but this is where the group will design a community healthcare initiative. And once it's designed and it's presented as that's your capstone to the faculty, then you have the full year to implement it as a group. And we hope that we go into communities, and it's not just a one and done, but we engage with community and we continue to provide services where they are needed. We continue with the interprofessional seminar 2. And as we go and we move forward, the third semester is very much like the second semester. For the first semester, we cover dermatology, ophthalmology, ear, nose, and throat, pulmonary medicine, cardiology, and hematology. In the third semester, we covered gastroenterology, genitourinary, renal, musculoskeletal, which is rheumatology and ortho, and psychiatry and neurology. So the courses that are a little bit different here is cultural issues in healthcare, which goes hand in hand with public health policies and advocacy. And then we continue doing the interprofessional seminar. And the last semester in the didactic phase, the clinical medicine 3 is where we pay attention, we really focus on special groups like women's health, pediatrics, emergency medicine, surgery, and infectious disease. So the learners will apply everything that they've learned so far to these specific groups. We have advanced pharmacotherapeutics, which is one of my favorite courses to teach because it is not lecture-based. The students are divided into small groups. They're given a very complex case where the students have to come up with a solution. There is no right or wrong solution, but the students have to justify why they choose to do to the interventions that they chose. The clinical skills and procedures, that's where you will learn how to put in tracheotomy, maybe a chest tube, is a central line, that's access, venous access through your neck or your shoulder above your, below your clavicle. So all those technical skills that are required for us as physician assistants. And then we have applied medical genetics and the last course of our research project. We also have ethics, law, and social justice and medicine. And again, this is paired with the public health policies and advocacy and cultural issues in healthcare, and then ethics and law and social justice. So there is a thread that goes through the curriculum, and it's all focused on rural health advocacy. And then once you complete the didactic phase of the program, you will have an assessment where you have to take an exam that is very much like the boards that you will take at the end of your training. And you have to do a complete physical exam and an OSCE. You must pass those assessments in order to move on and be promoted to the clinical phase of the program. About the clinical phase of the program, we have had the blessing to be able to have affiliation agreements throughout going west, southwest, and northwest of Stephenville, primarily rural communities and rural hospital systems. It is a 12-month clinical phase. You spend 4 weeks in each of these specialties. And then you have 1 week when you come back, and you have Monday and Tuesday to study and practice your skills. And then Wednesday starts a series of assessments. And we also have a roundtable discussions on professional practice issues. Our required rotations are behavioral and mental health, emergency medicine, family medicine, internal medicine, pediatrics, surgery, and women's health. We do have 2 selectives. We call them selectives because we are observing how the learner is doing throughout, longitudinally throughout the clinical phase. If we feel that the learner would benefit of repeating a certain rotation, then we will select that for them. If the learner is doing really well, then we can do a specialty such as cardiology or orthopedics. And at the end of the clerkship, the students will participate in the 3-day end of rotation seminar in Stephenville. So after you complete 4 weeks, you're coming back home, coming back to campus for a 3-day end of rotation clinical seminar. And like I said, there are multiple assessments and then roundtable discussions on topics relating to PA practice. Our research is a requirement for graduation, and you as a PA learner have an option, 2 options. You can write a case report on a specific case with a patient, and then you write a literature review on the topic related to the case report. And then you will have an opportunity to have an oral presentation of the case and key findings of your research. The second option is a collaborative research project. I was able to implement this in other universities very successfully. And in short, we have a small group of learners, maximum of 3, which identify a healthcare need in a specific rural community. They do a literature review on the subject matter, and then they design and implement a community health initiative. And then they go back and they report on the outcomes of their initiative. So to give you an example, in one of the institutions where I was able to implement this, a group of students that identified an increased number of adolescent suicides in a specific community. So they went to that high school where that community was located, and they spoke with the guidance counselors and the principal, and they received permission to do a mental health training for students and stress coping skills. And then what to do if either yourself or you observe someone that is high risk for depression, anxiety, or suicide. They also went and got vouchers from the local psychiatrists and social workers, and any student that needed that care, they could go and have their care for free. So that community health initiative was done early in the academic year. The students went off on their rotations, and they went back a year later. All of the vouchers were used, and there were no suicides reported in that particular community. So because of that, the school requested that the PA program send students every year to do this training. So that's the kind of impact that you can have here at Tarleton University. That's the kind of opportunity that you will have to have an impact on a community. So I'm really thrilled to be able to bring this to Tarleton, and I think we're going to see some major beautiful results and positive outcomes. So I'm going to ask Professor Holbrook to
Yes, so I would like to preface with the information that I'm about to go over is admissions related, and this information is only accurate for the cohort that is currently applying, that the cycle is open, and that cohort will be starting in April 2026. There are changes that are potentially coming down the road, but they have not been published yet. So these are the information that we're going off right now. As soon as we have any of those changes finalized, we will be publishing them on our website and through CASPA so that everyone is aware of any changes. But currently for this cohort, we do have certain admissions requirements, those being a completed bachelor's degree, a grade point average of 3.0, and that needs to be in 3 categories: your overall GPA, your prerequisite GPA, and your U60 GPA. I often get asked, what does U60 GPA mean? So your U60 GPA refers to the last 60 academic hours that you completed. It is not limited to any specific level of academia. It can be of any of them. So if you're applying right out of your bachelor's program, generally that would consist of your junior and senior year. If you've completed a post-bac, it would consist of the hours you completed during your post-bac and then likely your senior year, and so on and so forth. If you completed a master's level program, it's just those last 60 hours of academic credit. What we're looking for with this metric is to make sure that our students are maintaining high academics. And additionally, we understand that during your freshman and sophomore year or your early academic career, sometimes there's a little bit of a learning curve in how do I study at this higher level of education? And so we take that into account by this cycle elevating your U60 GPA at a higher level whenever we're reviewing your application. Additionally, our prerequisite coursework include statistics, anatomy and physiology, This can be a combined anatomy and physiology 1 and 2 for a total of 8 credit hours, or it can be separated out as human anatomy and human or general physiology. Again, needs a total 8 hours. Additionally, we require microbiology with lab. So this is a 4 credit hour class, genetics, biochemistry, medical terminology, and psychology. I'd like to highlight the reason that we require biochemistry over organic chemistry, which is a more common prerequisite for most PA schools. So I'd also like to preface that we do not accept organic chemistry as a substitution for biochemistry, and that requirement will not be changing going forward. So biochemistry, we require this one because a lot of studies have been done to show that there is a better correlation in student performance and success with students that have taken biochemistry over organic chemistry, specifically in pathophysiology and pharmacotherapeutics. So that is why we chose this course that we did. Additionally, we require our students to have 500 hours of direct patient care experiences. What we're looking for with these hours are really that hands-on experience with the patient or that one-on-one interaction with the patient. Common experiences that we accept are medical assistant, certified nursing assistant, physical therapy aide, occupational therapy aide. It can be in mental health, that is also considered dietitian or nutrition. Really any sort of interaction that you have with a patient that you are providing meaningful care to them as a patient. We do not accept shadowing or scribing currently as fulfilling those hours. Additionally, we do require 3 letters of recommendation. We strongly recommend that at least one of those hours do come from a PA, but that is not a requirement. And then also you must complete the personal statement and narratives associated with the CASPA application. Additionally, we do have certain, what we're referring to as preferences on the applicants that we're looking for in our program. So this goes back to the question of what are we looking for in our applicants? What are we looking for in the application that gives you a leg up and likely to get into our program or at least get to the interview phase? So we do have 2 categories of students who are a guaranteed interview, not acceptance into the program, but interview if they meet all minimum requirements. And those fall into 2 categories. If you're a current or former U.S. military and current or former Tarleton State University students. So the reason that we specifically chose these 2 groups are because the university at Tarleton State University is very pro-military, and our goal is to receive very high ranking as a military school. So in order to help promote that initiative is we are encouraging military applicants into our program. And then a lot of the mission of the president of the university is to bring Texas residents and educate them at our undergraduate level, so at the undergrad Tarleton State, and then to continue to educate them at the master's level and ultimately so that our students will go out and practice and enroll medicine. And so that's why we have that preference of Tarleton State University students. We also give preference to applicants that fall into these other categories. These preferences, really, this just means we give you extra points or the committee views them more favorably if they have these characteristics. Rural Texas residents, first-generation graduates, childhood or current resident in a medically underserved area, and just demonstration of resiliency and adaptability throughout their life experiences.
So about our program, our facilities, we have a brand new 92,000 square foot health professions building where the physician assistant program is housed. Here we have a simulation center where students will interact with high fidelity simulators in our simulation center. Our simulators are the simulators that the Department of Defense uses to train their field surgeons. So these are very state-of-the-art, high-definition simulators. And we have 5 hospital rooms. 2 will be trauma bays, which can flex as operating rooms. 1 critical care unit, 1 med-surg unit, and 1 labor and delivery unit where we have a newborn, but we will also have a 6-month-old and a 12-year-old. So we will be able to simulate across the lifespan and across all aspects of delivering care in urgent, emergent care and inpatient care, that right here on campus. In addition, we have 10 OSCE rooms. These are exam rooms. They are fully operational, where the students will do their OSCEs. This simulation center is considered to be medium to large simulation, and we're hoping to, in 3 years, be able to have sufficient data to have it independently accredited. So we're so excited to bring this to Tarleton. We also have a clinical skills lab where we can accommodate 60 students in the lab. It's quite large, and that's where the students will learn how to do the physical exam and clinical technical skills. Our highlight of the building is our anatomy lab. Our anatomy lab is a state-of-the-art, as I said at the beginning. It is a multimodal. We have plastinated specimens. These are human remains which have been preserved in a resin, and you can have hands-on and be able to visualize the anatomical parts. We also have a Syndaver. Syndaver spelled Syndaver. Syndaver is a simulated cadaver. It is made out of fiber, salt, and water. It is not toxic, but you are able to dissect it, open it, and feel. The feel is exactly like a fresh human tissue, but without the fumes of formaldehyde and without the concerns of allergic reactions. We also have a digital dissection tables, tall-tech tables, which are a very high order of thinking and with clinical application. And in combined with that is our virtual reality units, where you can put on a headset and you can see everything in 3D, and be able to rotate and move body parts. It is the state of the art, and we are so excited to have that here. I wanted to mention that our anatomy lab will be the 4th largest plastinated library of human remains in Texas. So actually in the nation, I should say. So we're very grateful for the support of Texas A&M and Tarleton State University executive leadership for their support, and we're able to offer this to our learners. We have also state-of-the-art, technologically advanced classrooms where we will do our instruction as well. So that's about our facility here at Tarleton, and we're excited, and we hope that you come and visit and you're able to see our facilities here in Stephenville. For questions about application preparation or prerequisites or patient care hours, we encourage you to contact the Division of Health Sciences Academic Resource Hub, and you have the number there and the link to the resource hub. And then if you have any updates about changes in your current application, please email us at pamadmissions@tarleton.edu. We recognize that you may have pending prerequisites, or that you are completing your bachelor's degree now in December. So when that happens, we encourage you to please send us an email and inform us that you have completed all of your requirements and have attained your bachelor's degree.
Yes, and just to highlight off of what Dr. Diaz was saying, so our current deadline for admissions this cohort or for this first cycle is December 1st. We recognize that bachelor's degrees or some prerequisite coursework may not be completed by December 1st, but they will be completed in December. So we are giving a grace period for all of our applicants who have completed their application and it's submitted by December 1st. As long as you send us your updated or submit into CASPA your updated transcripts that show your degree has been awarded and any prerequisites have been completed, you've updated your electronic transcripts on CASPA, or you have made any other additional updates to your application, you have until December 31st to notify the program of those changes, and the committee will still evaluate your application and consider it for an interview. I would like to preface with this, though, that as we continue and advance in our cohort or through this application cycle, interview seats will become very limited towards the end of the cycle. So we do encourage you to try to fulfill all of our requirements as soon as possible.
All right, thank you so much. This has been very helpful to hear. And I want to say to our live audience members, if you do have questions of your own, please go ahead and submit those. You should see a Q&A box or the chat box that you can use to submit your questions. We'd love to hear from you. But in the meantime, I have lots of questions of my own. So just to get the ball rolling, I did want to bring out the total number of credit hours that are needed to complete this degree. I don't know that we mentioned that.
The total number of credit hours to complete the degree is 120. This is up in par with the number of credit hours across the country of PA programs. It is a very robust, accelerated program. But we are testimonies that it is doable. It can be done.
Yeah.
And successfully.
Yes. Well, and you mentioned that down the road plans are for the program to become a doctoral level program. I'm just curious, what is the current state of PA programs in general? Are all of them currently master's programs that will migrate to doctoral level?
Yes.
Okay.
So currently, all of the PA programs are master's level programs, but they are now starting to create a bridge to doctorate. So you may, when you do your research, you may find that there are a few PA programs that do offer this bridge to doctoral degree. So we already have our curriculum and our for the bridge to doctorate, and then ultimately the transition from master's to doctorate. So the ARCPA, our accrediting body, already has published the accreditation standards for that. We are ahead of the curve. Tarleton is ahead of the curve. We are ready to go as soon as we get the mandate that it has to be offered. This is exciting as a PA, a longtime PA. This is something that personally I have been advocating for. And I'm excited to see this come to fruition within the next few years.
And so once at the doctoral level, would students be able to enter that program straight from a bachelor's degree?
Yes, ma'am.
Okay, very good. For those who may not know, Tarleton State University operates in several locations. Our main campus is in Stephenville, Texas, and we also operate in Fort Worth, Waco, and Bryan, Texas, in addition to our online program. So, Dr. Diaz, you mentioned this is a campus-based, residency-based program. So where exactly is it?
We are in Stephenville. We are on main campus in Stephenville. That's where all our courses will be offered. And then once you complete the didactic phase of the program, that's when you go to our clinical sites throughout Texas. We do have most of our clinical sites are right here in Texas. So we don't send students out of state. We do have a couple of rotations right over the border in Oklahoma. In Altus, Oklahoma, we have a couple of rotation sites up there. I wanted to highlight something, and it's that we have established clinical hubs. So if we send you up to the Panhandle, for instance, we have a representation of all of the rotations: emergency medicine, family medicine, women's health, pediatrics. So you will do, if you're up in the Panhandle, you will do at least 3 or 4 rotations up there in the Panhandle. So you won't be traveling all over the state back and forth. We will have a embedded clinical faculty there in the Panhandle that will be overseeing all of the students. So they will have someone that is part of our faculty, and is part of the physician assistant programs faculty that will be right there beside them and available for them. And the same thing in Wichita Falls. So we have the Panhandle, Wichita Falls, and then going towards San Angelo. Those are our clinical hubs. The one in Wichita Falls is the one that overlaps just over the state line to Oklahoma. And that's the only one that we go to another state, but it's a drivable, you can be there in 20 minutes from Wichita Falls.
And
No, go ahead.
sorry to interrupt. I just was,
sorry.
Students have any control over exactly what part of the state they're sent to?
So we do request that students submit what their preferences are and what their availability is, and we will take that in consideration when the assignments are made. We want to be considerate of everyone's needs. However, if there is a rotation site that there's an availability, we may find ourselves, we may need to send you, not necessarily where your preferences are. So, you tell us what your preferences are, we take that into consideration, but we cannot guarantee that every single rotation will be in that area.
Yeah. And so how are housing and living expenses handled during the clinical phase?
So the Tarleton State University has formulated a very generous living allowance for this, and taking in consideration that they will need housing in those clinical hubs. We are currently working on possibly establishing some agreements with apartment complexes. And we will share that information as soon as it becomes available. But right now, what we have put in place in terms of your living allowances is probably double than what we generally give to take that into account.
Thank you. Can you talk a bit more about the accreditation process and timeline? Because people may be curious and concerned about that. It sounds like we can't make any guarantees. Sounds like the program is in good shape.
Yes.
The news of the provisional accreditation any moment now.
Yeah, exactly. We are very, very optimistic, and after going through we submitted our application, we had our site visit, we had our feedback from the site visit, and based on that, on the feedback, and my previous experience, this is the third program that I designed. So, with that experience, I'm very, very optimistic that we will have a positive outcome. I have to say that this is not about me. I have a team of faculty and staff that have worked tirelessly to develop this program right alongside me, and I would not be able to do what I do if it were not because of them. So I want to recognize that and express gratitude for that.
Yes. So once we receive that provisional accreditation, at what point is the accreditation process fully completed? How long does that take? And happen before this first report finishes the program? Yeah,
excellent question. So once we receive accreditation provisional status, which I want to mention that accreditation provisional status is a fully accredited program. What it means is that this is a brand new program and it's within the first 3 years of its existence. So, but it is fully accredited. After 3 years, and during the first 3 years, we have several site visits. that we need to we undergo at the accrediting body comes and oversees and makes sure that we are doing what we said we were going to do. And then after 3 years, if everything goes well, which I fully expect that it will, then we will be given accreditation continued status, which is for 10 years. So every 10 years, we go through this process again. So, but the provisional, those first 3 years is what we call accreditation provisional. And then followed by that would be accreditation continued.
So then what happens at the end of the 120 credit hours? How does someone become a physician's assistant? Is there
I think I'm going to have Professor Holbrook answer that question.
Yes, so once our students graduate, then they sit for the boards, the NCCPA boards. They have to pass the boards in order to be able to apply for their license and then be able to practice. So, and it is a requirement that they graduate in order to be able to sit for the boards.
Okay, interesting. All right, so let's talk about who should consider this program. There may be many people who are drawn to careers in healthcare, but it's so broad. How to decide whether you want to be a nurse or a PA or a physical therapist or an occupational therapist. There's so many pathways. So what type of person from a characteristic or personal qualities, and also academic background are people who pursue coming from specific academic programs typically?
So we do not require a specific bachelor's degree in a specific area. As long as you have the requirements that we delineated, you will be considered as long as you have a bachelor's degree. So I've had cohorts where I have social workers, teachers, engineers that have completed the requirements, have their bachelor's degree, and they apply to PA school. And so if you notice, social work, teachers, engineers, these are people who are able to look at something globally, that are able to look at everything in a 360 and then make decisions of how to move forward for improvement. So if you are able to do that, the PA program will be something that you should consider. If that's something that you'd like to, you enjoy looking at things from every facet, because in clinical medicine, regardless of the discipline, whether it's pediatrics or orthopedics, we need to look at the patient holistically. So if you are able to do that holistically during undergrad or perhaps in your career, then the PA program may be something you would be interested in doing. One of the other things that I look for personally is those folks that this is their second career, that have life experience, whether be it as a paramedic, an EMT, perhaps a medical corpsman from the military, that this is their second career. We look at those very favorably, but we're excited to have a very very diverse group of students in the classroom that come from different maybe students who are coming straight out of bachelor's degree, maybe students that this is their second career, maybe folks that are in the military, because now you have a group of people that are looking at things holistically. That when they look at a problem and they sit to study together, they all bring a different perspective. So as you can tell, I'm very passionate and very excited about it. It's one of my most favorite things to see is when students come together, and I thoroughly enjoy being in the classroom and witnessing the growth of our students. So I don't know if Professor Holbrook would like to add to that.
Yes, so a lot of the highlights that I speak with the students about, is why PA? And honestly, that is the question on for the personal statement for PA programs is why do you want to be a PA? So what I always encourage students to tell me about is why do you want to be a PA specifically? Why not a nurse? Why not an MD or a DO or a physical therapist like you mentioned? So one of the beauties of the PA profession is our lateral mobility. So unlike a lot of other professions in healthcare where once you complete your schooling, you are restricted to a certain maybe specialty or a certain area based on what your schooling is. That's not something a PA has to worry about. We are trained as generalists. And so what that means is because we hit all those rotations, because we learn all the specialties, once our students graduate, say if they start in primary care, they're there for a couple years, maybe they learn during that time that they really have a passion for cardiology. They can move to a cardiology position without having to take any additional schooling. They just have to find a cardiology job, apply for it, and get hired. So that is something that is extremely impactful and something that's extremely prevalent and positive about what the mission and vision of our program is. We are trying to educate PAs to go out and practice in rural medicine. And in rural areas, there may be certain niches or certain specialties that they need to be filled. And so if a student wants to move into a rural area, maybe they have a background in dermatology, but the need there is orthopedics. They have already been trained and they already have the knowledge on how to treat those patients. So they can easily slide in and fill that gap. And additionally, I like to highlight the work-life balance that a PA can offer over some of the other medical specialties. So that was frankly a point for me that that encouraged me to go into this profession was I knew that I wanted to be a mom. I knew that I wanted to be there for my children. And so knowing that this profession allows a little bit more of that work-life balance than some of the other healthcare positions. I knew for me personally, I wanted to have that robust knowledge of medicine. I wanted to be able to be impactful in every level from seeing the patient, collecting the history, going through the mystery of what is going on. Let's diagnose this. Let's talk about all the different options that we can for treatment, but also being able to spend that time with the patient and educate them. As a PA, you often don't have the same requirements from your institution or from your hiring body to see a certain number of patients a day or to hit a certain quota on certain metrics. It allows us to be able to spend more time with our patients and have that more personable bedside interaction with them that oftentimes isn't afforded to other medical professions. And that's another big draw that was for me personally and that I've heard from a lot of our students on why they want to be PA. So not only do you have this robust knowledge on how to manage the patient medically, but you also get to know them on a personable level. They're not just a list of symptoms or a bag of diagnoses. They are people and we treat them as people. And so we get to hear them, we get to hear their stories. And oftentimes it helps us to provide better care to the patient themselves. So if we know that they have this external factor going on in their life, that may help us to figure out, okay, why is their diabetes spiking all of a sudden when it's been very well controlled on their medications? Now we find out they're going through a divorce. Okay, that makes a lot of sense. And so then now we can use that knowledge in order to treat them more efficiently.
Thank you. Dr. Diaz, you mentioned that this is a competency-based program. Typical PA programs and would students receive letter grades for their coursework?
Yes, we do adhere to a letter grade in all of our courses. The only course that is a pass-fail is our summative evaluation course, our summative course at the very end. We assess every single skill that the student has received instruction in, and those are our program competencies. If those are listed on our website. So every single competency during that course is being assessed. Those are based on a pass-fail. Otherwise, aside from that, everything else is a letter grade.
And is that typical of PA programs or something that Tarleton's?
No, that is pretty typical of PA programs across the nation. There are maybe a handful of PA programs that may be on a pass-fail, but our program adheres to the letter grade, And like I said, the summative evaluation is a pass-fail. Towards the end, what we're trying to do is get students really in that mindset when they sit for the boards. Because when you sit for the board, you don't get a letter grade. It's either pass-fail. So we try to get you into that mindset that it's not about the grade, it's about, are you able to demonstrate the competencies that we have established?
Mhm.
And we do that from the very beginning, from day one.
Okay, thank you. I want to end by talking more about the admissions process. You mentioned this is a cohort-based program. How many students are you hoping to bring into the first class?
We plan to accept 60 students.
Okay. And
And if you won't mind, I would like to highlight additionally on your last question. So our program is letter-based, and we also, as a faculty, are very mindful of our student success. And so we have built into our curriculum and built in plans to catch if a student starts to struggle. We want to catch that early in their tenure with the program, so that way we can remediate and make sure that ultimately we are helping them to succeed. That is our goal. We want all of our students to graduate. And so us as faculty are here to provide mentorship and support to the student in whatever areas they need it. We've had robust and intentional support from the institution to make sure that we can provide resources to our students to be able to succeed academically.
amazing. Very good. You mentioned that the application deadline is December 1st. So just clear for this first class that will start in April of 2026, no applications will be accepted after that point.
Correct. So they must be submitted to CASPA. That does not mean they had to be verified by CASPA, but they had to hit the submit button on CASPA by December 1st in order for them to be considered for this first cohort. And again, this information is selective for this first cohort only. There may be changes coming in the future for for further cohorts, but for this year, December 1st is the deadline. But we will give them that grace period up until December 31st to complete all their coursework, bachelor's degrees, hours, in order to be considered, but we do not review an application fully until all of our minimum requirements have been met, which include all the prerequisites, meeting our minimum GPA out requirements, the bachelor's degree completed, hours completed, what have you.
That's an important point to make. Thank you for saying that. Very good. Okay. Something you said, maybe want to ask another question. Oh, I wanted to clarify for people who may not be familiar. You are saying CASPA, CASPA, which is an acronym for the admissions application. The first the first thing anyone would need to do to be considered for this program is to find the credential assembly, what this CAS stand for, Credential Assembly Service application for physician
Assistant.
So just want to make that clear because it's a little different. That is a little different from how many our other graduate programs work.
And that platform is for all PA programs. So the applicant only has to fill out one traditional application that they can use to apply to all programs. And then generally each program has a secondary application that's more specific to their program. So for ours, we really focus on asking them to put in an essay on their life experiences and then asking them to fill out some questions about their history or their past. Did they grow up in a rural area? Do they have medically underserved work experience? So we strongly encourage our applicants to fill out all those questions to the best of their abilities because it can only help them in their application review process. It will never hurt them based on their answers.
Thank you very much. So CASPA is a common application where you can apply to any PA program. And then once you've selected which schools you want, there probably will be some tailored questions specific to that institution. So
Yes, ma'am.
very much. Okay. Winding up here, recommendation letters. You mentioned that ideally you would want to see at least one letter from a practicing physician's assistant, but other than that, what type of information are you hoping to get from the letters?
Great question. So, like you said, so yes, we would prefer that one comes from a PA because that helps show us that you not only have interacted with a PA, but that the PA felt comfortable in order to recommend you for the profession. And so they're putting essentially their stamp of approval on you as they believe that you would be a good addition to the profession. So that's why we really look for that letter from a PA. We additionally oftentimes see letters from physicians or instructors. Sometimes it's character references. So really with these letters, we want to see that someone has viewed your character and deemed that you would be a good fit as a PA.
Academic letters, would those be helpful as well? Maybe from current faculty or?
Yes, ma'am. So from professors, instructors, lecturers, all those are accepted. So when someone's applying to PA school, we have this holistic view of them. Grades are extremely important because the rigor of our program is exceedingly elevated. So we want to make sure that the applicants that we're accepting can meet that rigor and succeed. So grades are a very large component, but as Dr. Diaz has mentioned in the past, we also look for that applicant that has that other world knowledge, who can bring in their life experiences in order to use them and apply them to what they're learning as a PA to ultimately be a better and more well-rounded PA once they graduate.
Just curious, you mentioned 500 hours of, is it observation or hands-on?
So it is direct patient care experience. I'm starting to decrease from saying hands-on because if someone is acting as maybe a dietitian or a mental health specialist, sometimes they aren't physically laying hands on the patient. Dietitian, they generally do, but say if you're doing a virtual mental health session with a patient, you may not be physically touching them, but you are providing meaningful care to them. So that's why I've started to change the phrasing of it as direct patient interaction. So whether it's you're having a meaningful conversation with them, maybe it's you're consenting them for a procedure, or you are working as a phlebotomist and you're taking the blood from them and you're running it in the diagnostic lab. Maybe you're working as an MA where you collect the history from the patient, you assist the medical provider in procedures. You are pretty much involved in a lot of different areas of their health. But as long as you can say that you have been meaningfully involved in the care of that patient, it's accepted. I do like to highlight that hours that are not accepted are shadowing hours. So that would be more like your observing hours and scribing hours. And the reason that we're not accepting those right now are because when you're working in those roles or you're acting in that position, you're more of a fly on the wall. You're observing and watching and you are gaining a lot of knowledge, but you're not truly interacting with the patient generally on a meaningful level. You're interacting more with the computer, or you're maybe interacting more with the physician outside of the room asking the questions, or the PA outside of the room asking the questions, but you're having less of that interaction with the patient.
So how would an applicant document their 500 hours?
Yes, ma'am. So there's a portion on the CASPA application that talks about experiences. So the applicant can put in health-related experiences. And so that's where your scribing or your non-direct patient care experience hours would be put. So oftentimes we get healthcare administrators. So those that are working more in the front office and less interaction with the patient, those are the experiences that would go there. The patient care experience hours are, like we mentioned, as the direct hands-on care. Part of filling out the application, you have the opportunity to put in your duties that you had during your role. In that area, I really like applicants to give me exactly what you did. Did you take the vitals? Did you administer medications? Were you administering vaccines or immunizations? How were you directly involved with the patient? Were you consenting them? Were you counseling them? So that's the area where you can really make sure that we as a program understand that the roles and responsibilities that you had during your experience hours truly do meet our requirement. In that section, you can also put in shadowing hours. In a different section, you can put in your leadership experiences, you can put in your extracurricular or volunteer experiences. So all of that can be put into that same rough area of your application. It's just divided out based on the categories.
Well, and that's
I'm
important.
sorry, I don't mean to interrupt you. May I? I'd like to add, for our military veterans and current serving in the military, we recognize that many of you have to your postings are very vary. You may be on the West Coast and then they send you to the East Coast, and maybe you'll be across the world somewhere, and that you're taking your prereqs in different, maybe online in different institutions. we do not hold that against you. We recognize that. We want to make sure that you understand that it does not count against you. And in terms of documentation of your direct medical hours, any commanding officer that you have been under can you can put them as a contact person, and it doesn't have to be the current person that you're with, because we realize you may be transferred to another station or another location. So we are fully aware of that, and we want to make sure our service members understand that it is not counted against you. On the contrary, it shows resiliency, it shows determination that no matter where you are in the world, you took the requirements and you are ready to come to PA school.
Yes. So just to clarify, so that means that we accept both community college credit hours, full university credit hours in both in-person and online hours for those prerequisites.
Thank you. Okay, so once an applicant is deemed complete, meaning they've met all of your initial requirements, all of the prerequisites with the minimum grades, the bachelor's degree is going to be conferred, all of that. They move on to review by your admissions committee. Does every applicant receive an interview?
So great question. So once we've confirmed that they met our minimum standards, they go through a various process of additional review of their application. And then ultimately we will start narrowing down based on the applications we received, the applicants that really embody our mission and vision statement. Those applicants then go to committee to be reviewed. And then ultimately the committee decides who will be offered an interview seat versus not. We receive an exceedingly high number of applications, so not all of our applicants, even those that meet all of our minimum requirements, will be getting an interview. It is only the select few that really embody our mission and vision statement, who have met all of our minimum requirements, who will receive that interview seat.
Thank you. So, and then once the cohort is solidified, classes begin in April of 2026, which is considered a summer session. Is that correct? And so at that point, initially, how many credit hours would a student be enrolled in? Is everyone on a full-time track, or is part option available?
It's solely full-time. We do not offer part-time. The first semester, I believe it's 15 credit hours. And each semester it varies between 15 to 17 credit hours. Our credit hours are calculated using contact hours. Those are the hours, that's the way that medical schools calculate credit hours, because it's been based on contact hours with the faculty and engaging in academic activities. So it's just slightly different because we do follow the medical model of medical training.
This has been amazing. Thank you so much for such a thorough overview of your program and this initial application cycle. We're so excited to see what happens for you in the coming weeks and months. So I did not see any questions from our live audience members, but I thank you for joining us. I want to remind you that a recording of this presentation will be available to review on demand on the Tarleton State University College of Graduate Studies YouTube channel. So feel free to go back and review it as you need to. And if you know of others who might be a good fit for our program, we certainly invite you to share the recording with them as well. So thank you to Dr. Diaz and Professor Holbrook. And I think with that, we can end our webinar. So thanks, everyone. Hope you will have a great rest of your day.